Today we will be discussing health literacy, targeting kidney disease throughout the Aboriginal and Torres Strait Islander population located in the remote areas within Australia. Our group consists of Sarah, Riza, Khin and Adelpha. We have broken our presentation up into 4 sections. Adelpha has undertaken research for Section A, of remote areas. I, Sarah, have researched Section B, which is health literacy. Khin will be discussing kidney disease in Section C, and Riza will be covering further research throughout Section D. Acknowledgement. We would like to show our honour and respect for the traditional owners and custodians of this country land. Overview. Section A, remote areas. Section B, health literacy. Section C, kidney disease. Section D, further research. Aims and objectives. To gain insight and understanding towards Aboriginal and Torres Strait Islander people living within remote areas of Australia and the connection between culture and their health. To identify and describe the social determinants of health which have influence upon Aboriginal and Torres Strait Islander people suffering from kidney disease. To understand culturally competent and safe nursing practice in context of kidney disease on Aboriginal and Torres Strait Islander people living within remote areas of Australia. Culture and health of Aboriginal and Torres Strait Islander people are intertwined with each other. The country land is the mother of the Aboriginal Torres Strait Islander community people. People, plants, animals, earth, minerals together make the country. Connection and care for the country show their own culture, identity, sovereignty, past history and traditional beliefs. Right to land, utilisation of their traditional lands as per their wish and engaging in traditional activities has the positive influence on their health. People living in their own land in remote areas have high positive attributes and low psychological distress than people living in urban areas. Education of ancestry, visiting cultural sites, language and storytelling reduce the psychological distress and minimise substance use. Connection to country and involvement in activities in their own land provide positive well-being and bring the feeling of empowerment, whereas loss of their land and cultural knowledge are considered as serious as reason for their ill health and distress. Aboriginal health not only involves the physical health of an individual, but the overall well-being of a community, including social, emotional, cultural and spiritual health. Disruption of harmony between these components causes ill health. For an example, a study by McLean et al. Showed that caring for a country by people of remote adherent land has enhanced their physical and mental health. The traditional and cultural practices have improved their diet and minimalised alcohol intake behaviour among community members. Cultural differences and social disparities have caused health inequity between Aboriginal and Torres Strait Islander and non-Aboriginal people. The difference in culture, value, beliefs, understanding has affected health treatment systems and made Aboriginal people less interested in using healthcare services. Language is linked to culture and make the base of learning and communication. Non-English speaking background of Aboriginal and Torres Strait Islander people lead to language and communication barriers, which create misconception, confusion and failure of health treatment. Therefore, strong culture, identities and social inclusion help to maintain health and positive well-being of Aboriginal and Torres Strait Islander people.
Indigenous community, the prevalence of CKD is quite high, incidence is high. Not only that, the progression from stages of 3KD to end stage is high, and once they are on dialysis, they'll have to leave their homeland and be away from their homeland, their near and dear ones, which is a huge social and psychological impact. And their survival on dialysis is not fantastic either. So that is the reality, what we are. facing.
Yeah, it was very disheartening, really, to have that put on you, especially when you're in the middle of all these good stuff. You've got plans for your life, and with kids and your wife and stuff like that. All that plan just seemed to go out the window once you hear that, and then you just scrub that. It's like scrubbing off the whiteboard and starting again.
It opened our eyes, my eyes, when I came down here and seen how many people were actually on it. The first day I walked into the one at Royal Perth with Ron, I was shocked. I looked at him and said, "Is this how many's on there?" And he reckons, yeah. They were like every single chair full with somebody in the same situation.
In Ronald's case, he had a congenital disorder that led to kidney failure at a young age. But kidney disease can occur at any age. The interesting thing about kidney disease in Aboriginal populations is that occurs 2 or even maybe 3 decades earlier. So instead of people in their late middle age predominantly developing kidney failure, we're talking about young people, even if they don't have a congenital problem as Rono had.
The hardest thing is because I don't have a job financially, and I've got bills to pay. It's just that's the hardest thing.
Although many of them put on a very brave front while they're in Perth, you didn't realise just how sad and lonely and and lost they were in Perth. And then you go up and you see the same people in Broome or Kununurra or Fitzroy or wherever they come from, and it's just chalk and cheese.
I try not to be so anxious into getting a kidney because I know how long you could wait. If I put all my energy and time into this one thing, then I'll miss everything else. I'll miss the time with my kids, I'll miss connecting with my wife, my family. All the real important stuff in my life I'll miss just because I'm waiting on this one thing.
Traditional method of finding a kidney for patients is by taking what we call HLA matching and finding who's got the best match and allocating that kidney. But essentially for Aboriginal patients and Caucasians, there's very little matching, and it makes it much harder therefore under that system to receive a kidney if you're Indigenous and you go on the waiting list. But it's not the only thing that holds back the Indigenous population, because they do have much higher risk for infections anyway, and that's one of the burdens we face, is that the drugs needed to stop your body rejecting your kidney are also affecting your ability to fight infection, and so infectious complications are still a big problem following transplants.
Hey, what the matter, my baby? I miss you too. I miss you big as the sky.
Subsequently, in gaining insight into the cultural impacts and links between culture and health, an understanding towards the reluctance of Aboriginal and Torres Strait Islander people seeking or continuing treatment within available healthcare facilities became clear. Aboriginal and Torres Strait Islander had developed mistrust to healthcare practitioners and facilities due to people dying in hospital. Moreover, in the past, nurses were also involved in taking babies and children away from their mother to be sent to orphanages and missions. Their lack of trust to healthcare professionals and limited health awareness lead to delayed treatment of their illness that caused to premature death. There are instances that treatment is discontinued when a lengthy treatment is involved due to their fear of dying away from their land. In the Northern Territory, it has a small and culturally diverse population spread in a vast area, which renal service is a challenge to access due to its geographical location. Population consists of approximately 233,000 people, where 30% of its population is of Aboriginal heritage who live predominantly within the remote area of the land. Due to the limited health facilities in remote areas, strategies are being in place to bring the services closer to their home. Currently, public health sector develop hubs in Northern Territory called the Top End Health Service, which offers renal ward, acute hemodialysis and plasma exchange, home hemodialysis training, drop-in center for home hemodialysis, peritoneal dialysis, transplantation, chronic kidney disease management, allied health services, and end-of-life care. This service prioritizes not just treatment but also awareness of kidney disease.
Health literacy empowers people to make healthcare decisions in order to maintain or improve one's quality of life. Through knowledge, motivation, and the ability to access information and resources, health literacy has power to prevent disease as well as promote good health. Aboriginal and Torres Strait Islander people living within a remote Australia are generally exposed to significantly higher mortality and hospitalization in contrast to those living in the metropolitan areas. Studies suggest Aboriginal and Torres Strait Islander people tend to experience a greater level of poor health than non-Indigenous people due to a variety of reasons. Some examples include poor environmental health, housing, remoteness of some communities, nutrition, breastfeeding, physical activities, tobacco, drug and alcohol use. The significance of health literacy between Aboriginal and Torres Strait Islander people become considerable as research has shown globally that good health literacy is a significant contributor to improve health outcomes. Barriers such as cultural indifference and lack of cultural sensitivity and safety are still very much prominent throughout healthcare facilities available within Aboriginal and Torres Strait Islander communities. In effect, this creates discouragement towards Aboriginal and Torres Strait Islander people and their expectance of treatment or likeliness to return to a particular healthcare services or facilities. Due to the challenges of some services being situated closer or within metropolitan areas, Aboriginal and Torres Strait Islander people living within remote areas throughout Australia are less inclined to access education and healthcare resources, as this required them to either travel a long distance or relocate to a closer area away from their families and their support networks. This is where health literacy becomes a vital tools in bringing awareness to community who are not aware of information relevant to improving their health or ways in which they can access the resources of health.
In the years 2012 and 2013, approximately 1 out of 5 Aboriginal and Torres Strait Islander people aged over 18 show signs of chronic kidney disease. Statistics also show that around 9 out of 10 Aboriginal and Torres Strait Islander people with signs of chronic kidney disease are unaware of the diagnosis. Aboriginal and Torres Strait Islander people are more than twice as likely as other people to develop chronic kidney disease. One of the main reasons for hospitalization within Aboriginal and Torres Strait Islander population is hemodialysis, which was 11 times higher than other population in 2008 and 9. The impact of chronic kidney disease upon Aboriginal and Torres Strait Islander people can be life-changing. Aboriginal and Torres Strait Islander people suffering from kidney disease have higher chances of experiencing many forms of disadvantage. These include unemployment, undereducation, poor standards of living, poor standards of housing. Aboriginal and Torres Strait Islander people living within remote areas are also more likely to experience psychological distress and depression due to not only the effects of the disease but also the distance required to travel in order to gain treatment or health advice. This can be distressing due to their connection towards the motherland and their spirituality. Effective communication between Aboriginal and Torres Strait Islander people and health professionals is vital. This not only requires health professionals to be culturally sensitive, but also clear and concise in the delivery of healthcare and advice.
due to the language barrier and possibly poor health literacy. Ineffective communication during hospitalization can cause some patients to become uneasy. In addition to this, the Aboriginal and Torres Strait Islander people's trust within the healthcare system can also become uncertain as they are unaware of the procedure and treatment plans.
Social determinants of health are physical condition and social factors of the environment in which people live, play, work, and age. It includes physical environment, social environment, biology and genetic characteristics, healthy child development, employment, working condition, health practices, health services and resources, social support networks, education and literacy. There are 4 main social determinants in which we will be talking about today. Health services and resources. Accessible health services and resources made available to the Aboriginal and Torres Strait Islander communities living amongst the remote areas throughout Australia are known to be limited. However, accessible health services and resources are not only those which are physically available but also inexpensive, culturally acceptable and known to be available to the community. There have been many strategies set in order to improve these gaps within the system, which includes providing patients with transport, incorporating home visits, as well as the employment of Indigenous professional and health workers in order to gain cultural safety, providing health services based around a holistic approach of health, well-being, and many more. Biology and genetic characteristics. Over 50,000 years, the Aboriginal and Torres Strait Islander people have been secluded from rest of the world. Research also shows that the Aboriginal and Torres Strait Islander people are not only one of the most genetically diverse species but are also one of the oldest. Pre-colonization, Aboriginal and Torres Strait Islander people were able to overcome extreme climate change, drought, flooding, and many other challenges of survival within the remote areas of Australia. With the absence of disease and illness, the people have been proven to be resilient and one of the healthiest in humankind. Since European settlement and a prolong of disease and illnesses, the health and the well-being of the people have been greatly affected, introducing a negative health outcome not only physically but also mentally and emotionally. With the lack of knowledge and awareness of such illnesses and diseases and also low literacy rate during this time period, the susceptibility of these health issues towards the people continue to increase throughout each generation and still today continues its effect. With the cases such as chronic kidney disease, historical factors such as change within their once active lifestyle and role and the food they consumed influence the development of kidney disease and other chronic conditions such as diabetes over time. Healthy child development. The health of the child begins at the early age, some would say even before conception. For children growing up in the remote areas throughout Australia, life can be a bittersweet. Culturally rich, surrounded by their love and connection to the land, their spiritually and long history of ancestry, however poor in health literacy and education and health awareness. Certain measures such as birth weight, immunization, infant mortality, ear health, smoking in pregnancy, hospitalization due to intentional self-harm, births to teenage mothers are just a few aspects in which the potential to affect the development of a child. Although Aboriginal and Torres Strait Islander people represent less than 2.5% of national population, they account for approximately 9% of people commencing kidney replacement therapy each year. Whilst not all the cases of kidney disease are genetic, research have shown that kidney disease can and may still run in the families. The importance of health literacy in educating people and the children about these risks and understanding the sign of potential health risks become a vital tool when ensuring the maintenance of good health. Employment and working conditions. Employment and working conditions have a power to impact any person's health. This particularly relate to the concept of social gradient, those whose income is relatively higher and tend to have better health than those who are unemployed or on significantly less. Torres Strait and Aboriginal and Torres Strait Islander people who live in the remote areas of Australia not only have a fewer opportunities to gain employment and on a subsequent income, but also have to deal with an excessive fresh produce pricing, making affordability towards the fresh food and vegetables almost impossible.
Nurses must understand that the health of Aboriginal and Torres Strait Islander people is interlinked with the health of their country. This is an essential aspect which needs to be considered when providing healthcare services. Proper communication and culturally appropriate behaviour by nurses will lead to better quality of care. Nurses need to adopt a more holistic approach to healthcare, which is free from biased opinions, discrimination, and racism. It is also important to acknowledge the patient's cultural beliefs, values, preferences, and incorporate traditional medicine healing methods wherever possible. Due to the rate of chronic kidney disease being significantly higher amongst Aboriginal and Torres Strait Islander people in comparison to the overall population, motive for nurses to create awareness amongst remote communities becomes essential, to which can encourage early detection in minimalising the rate of occurrence. Nurses must provide a patient-centred care approach, involving the patient as well as the family members in healthcare decision-making for safe and appropriate healthcare treatment. Thus, in order to address health literacy of Aboriginal and Torres Strait Islander people suffering from kidney diseases in remote areas, nurses must educate patients about diseases and include them in informed health decision-making.
Conclusion. The significance of health literacy among Aboriginal and Torres Strait Islander people living within the remote areas of Australia is shown to be effective in the potential to minimalising further health issues and creating awareness. Social determinants such as health services and resources, biology and genetic characteristics, healthy child development, employment and working conditions are all the important aspects which have the potential to influence the health and well-being of Aboriginal and Torres Strait Islander people living in remote areas. Those who suffer from kidney disease throughout the remote areas need to be treated with just as importance as community within the metropolitan areas of Australia. It is clear that healthcare professionals must be culturally sensitive in dealing with their patients, particularly with Aboriginal and Torres Strait Islander. It is the way to encourage them to trust the healthcare system and may eventually motivate them to learn more about their health through encouraging health literacy and awareness. Thus, health literacy is imperative in targeting positive attributes towards treating and creating awareness of kidney disease throughout the Aboriginal and Torres Strait Islander remote communities within Australia. Summary. As healthcare professionals, it is imperative that we uphold and continue to embrace cultural awareness for Aboriginal and Torres Strait Islander people to be treated equally, free from judgment and racism in an environment where they feel welcome and at ease. The importance of health literacy can in some instances be life-changing, encouraging Aboriginal and Torres Strait Islander people living in remote areas to embrace education as well as understanding the signs of disease such as chronic kidney disease can be the difference between developing something treatable in retrospect to something potentially life-threatening. The social determinants of health have the power to influence the outcome of one's health, whether positive or negative. Hence, the limitation of services and facilities within the remote areas of Australia need a greater focus in gaining government funding and improvement in order to seek the change we need.